I'm pleased today to see so many faces, even though we are in the middle of a pandemic, and so we've had to do a few things differently. We also know that we cannot keep the good people of Wallaceburg away from this announcement today, and so many of them are joining us on Facebook Live, and we know that also doing it through Facebook Live really allows the world to come in and share in this good news today. I'd also like to acknowledge our special guests here today. We have Honourable Monte McNaughton, Minister of Labour, Training and Skills Development, and more importantly for us today, our MPP of the Lambton-Kent-Middlesex riding. We have Chief Charles Sampson here today, who's Chief of Walpole Island First Nation. We have Elder Eric Isaac and his wife Patty, and interestingly enough, we heard that Patty was one of our very first volunteers at the Wallaceburg site. I think it's 50 or 60 years ago, so pretty amazing there. Danny Deliri is here to share some of his gifts from the Walpole Island First Nation. Mayor Darren Caniff is with us this morning. Municipal Councillors Carmen McGregor and Aaron Hall. Greg Arson, Board Chair of Chatham-Kent Health Alliance. Board members Brian Glover and Deborah Hook from Chatham-Kent Health Alliance. We have Mary Lou Crowley, the President and CEO of the Chatham-Kent Health Alliance Foundation, and Bob Hockney, the Vice Chair of the Foundation. So happy that all of you could join us in person today. To make this announcement, it is always such a pleasure for us to welcome home the Honourable Monte McNaughton, who is our Minister of Labour, Training, Skills and Development. He brings this morning this announcement on behalf of the Honourable Christine Elliott, the Minister of Health and Long-Term Care.
Welcome to this morning's very, very exciting and long overdue announcement. I also want to welcome the Chief. I know we're getting together afterwards. It's great to see you. Congratulations on your election win just about a month ago now. And also to say hi to Mayor and the councillors that are joining us here today, but most importantly to all of the supporters of the Wallaceburg Hospital. I want to thank Lori and everyone here for having me today. I was just here actually a couple of months ago prior to Labor Day weekend when the weather was certainly much, much warmer. I was saying to some folks this morning, I think it was 30 degrees the day I was here, as we're handing out Timbits and donuts and muffins to thank all of the healthcare heroes for the great work that they've been doing throughout the pandemic. So I'm happy to be back and see some of those same faces. And to have an opportunity again to thank those healthcare workers in person for their courageous work in the face of COVID-19 and the uncertain times the pandemic has brought on. To all the nurses, personal support workers, doctors, and other staff who look after patients and our families and keep our hospitals clean and organized. Time and time again, your commitment, your strength, and your selfless service have reminded me of what the Ontario spirit is all about. As a few of you may know, healthcare in Lambton-Kent-Middlesex has always been important to me and my family going back generations. My grandfather, Jack, helped found the Four Counties Hospital in Newbury more than 50 years ago. It's a good thing he did too, because years later I would have to make a visit to get some stitches as a rowdy 6th grader. Years ago as well, alongside many Wallaceburg residents, thousands of them, I also protested the closure of this hospital's emergency department. I remember rallying with friends of Save Our Sydenham Hospital. Of course, we have with us today my good friend and the champion for this hospital, Jeff Wesley, who I know led the charge back then. Of course, Rex Crawford, Pat Davis, Conrad, Sheldon, Jerry, and literally thousands of people in this community defended this hospital. And it brings us to where we are today. It's been a long, long journey to get here. So I'm so glad to see that it's still operating today and has a wonderful, amazing future in front of it. So getting to share this next bit of news is extra special for me. As the first part of a series of upcoming renovations, the Ontario government is investing $7.36 million in the Chatham-Kent Health Alliance Wallaceburg Hospital. This funding will go toward the construction of a new power plant to support this fantastic hospital's future. This will be the first stage of a redevelopment plan, And I can tell you, and you'll hear more about this, but shovels are getting in the ground in the next number of days. Following this, the emergency room and diagnostic imaging will be moving to their new location on the north side of this campus. The importance of local healthcare centers has been made especially clear throughout this pandemic. While fighting COVID-19 remains a priority, we're continuing to invest in things that matter to people in southwestern Ontario and beyond. So many big improvements are coming, and I could not be more excited. People tend to talk about infrastructure, in particular hospital infrastructure, in terms of bricks and steel. The dollar amounts for projects can be so large, most of us can't relate to them. But my team and I know it's all about people. When we look at projects, we always ask, who will it help and how does it help them? In this case, I know this funding is not just for us here today, but for generations of families to come. For families, those in the area now and those in the area to come. For rowdy kids who need stitches to our parents and grandparents who may require extra care. As Lori mentioned, I also want to give a lot of credit to my colleague and Minister of Health, Christine Elliott, and her parliamentary assistant, Robin Martin, as well as my friend and colleague, Rick Nichols, who is as big a supporter of the Chatham-Kent Health Alliance as anyone. And of course, to Lori Marshall and her team, who have provided stellar leadership to the hospital over the past several years. Lori, you likely won't remember our Save Our Sydenham rallies, but I know you know a lot about the value of rural healthcare. So on behalf of the Government of Ontario and the people here in Wallaceburg, thank you. And thank you everyone for being here today. I look forward to the day when I'm back to tour your newly complemented power plant and the hospital redevelopment. Thank you everyone.
With shovels in the ground for the power plant, we're one step closer to our journey to revitalizing the Wallaceburg site. The power plant will replace a very aging infrastructure with boilers, generators, and electrical distribution equipment. What this is really the backbone of the hospital. And I think one of the things I want to reiterate that Minister McNaughton identified is that this is important for future redevelopment. If there was no intention of redeveloping this site, we could just replace a boiler in the particular hospital setting that we're in right now. But this commitment to build this power plant means that there will be more good things to come. This Wallaceburg site remains committed to be anchored in 24/7 emergency department services, medical beds, and what I would say is a growing ambulatory care service. It is here for today, it is here for the future. I'd also like to thank our builder, Todd Hodgins from PML Construction and his crew for their work that's about to begin on this exciting project. I also want to thank the Minister for a recent announcement of $2.1 million in Health Infrastructure Renewal Fund. And priority projects there relate to asbestos abatement, so removing some of that to get ready for future developments at this site and updating our fire and sprinkler systems. All of these projects really signal a commitment to ongoing and future care. Once completed, we'll be able to serve really this community for years to come. We know that the area in Wallaceburg and the Walpole First Nation, Walpole Island First Nation are high areas of need. Compared with other areas of the province, we have high rates of chronic disease such as diabetes, cancer, heart disease, more hospital admissions, and have the highest rate of emergency visits in our region. Couple this with high rates of, unfortunately, smoking, lower consumption of fruits and vegetables, and lower income levels, we see the need for contemporary and progressive approaches to care.
Thank you, Lori. Good morning, everyone. It's a beautiful day in Wallaceburg. Although, as a native son to Wallaceburg, I find it hard to imagine any other kind. On behalf of the Chatham-Kent Health Alliance Board, I'm grateful to the Ontario government and especially to the Ministry of Health and Long-Term Care for today's significant announcement. A special thank you to the Honourable Monte McNaughton, Minister of Labour, making the trip back home to share this terrific news with us today, and for your ongoing support to our hospital. It's truly a pleasure to have you here today. Our momentum to redevelop this site is now in full swing with the construction of the replacement power plant. We are pleased to officially welcome construction crews to begin this important work. When constructed back in the 1950s at a cost of approximately $900,000, the hospital on this site became a jewel in this community. It was built with the vision of people like Mr. Burgess, protected by people like Jeff Wesley and Conrad Doyle, and loved by every person who entered its doors. Today, with the support of the Ontario government, the staff and management of CKHA, the development on this site will continue to provide for the people of our community as they raise their families, build industry and agriculture, and develop leaders and champions. Over the years, our renewed focus on this site has seen reinvestment in the emergency department, additional respiratory therapy coverage, capital equipment upgrades, and the addition of specialty clinics, and also partnership to provide community care nursing clinics. All of these set the stage for the reinvestment we are seeing from the Ontario government to ensure that hospital services remain an important part of this community. A well-functioning community hospital helps ease the stress for its patients by offering high-quality care. CKHA's Wallaceburg site is the healthcare hub for many residents in the Wallaceburg, Dresden, Walpole Island, and South Lambton area.
I'd now like to welcome Chief Charles Sampson, who will bring remarks on behalf of Walpole Island First Nation.
Bkejwanong, good morning, everyone. I want to start by thanking Elder Isaac for the blessing, and I also want to acknowledge and thank Minister McNaughton for his announcement. And I also want to thank members of the Chatham-Kent Health Alliance for acknowledging the traditional territory, the Three Fires Confederacy, and the homeland for the Anishinaabe. The Walpole Island First Nation is a key member of that confederacy, and we are the homeland to the Chippewa, Potawatomi, and Odawa peoples. Niji, my friends, it is a tremendous honor to be here today and to be a participant in this ceremony. And before proceeding any further, I'd like to take a quick opportunity to honor some of the people from our First Nation who worked as nurses, aides, and support staff here. As some of you may know, we have a long past connection in our support for what once was the Sydenham District Hospital. On this, I would like to take the time to honor some of our tireless people who worked at that hospital. Such people as Jean Reitman, Florence Sands, Robbie Sands, and of course, our first member to work here, Patty Isaac. Jimmy Wedge. And a special note, I'd like to point out that Eric and Patty just recently celebrated their 70th wedding anniversary. That is a major milestone for any community. And just as a quick aside, I recently asked Eric and Patty, how did they make their relationship last for such a very, very long time? They looked at me straight in the eye and stated point blank, I learned to duck when I was a very, very young man. On a more serious note, I'm going to take an opportunity to state to Minister McNaughton and to the Government of Ontario that we, the Chief and Council for the Walpole Island First Nation, are very concerned about the treatment of our Mi'kmaq brothers and sisters are receiving in the exercise of their inherent right to fish and make a living. Some of this treatment appears to be racially motivated, and this concerns us. We believe the Mi'kmaq people have the right to fish and make a living, and that right is protected by the Canadian Constitution and by the Supreme Court of Canada. We also firmly believe the Mi'kmaq people are equal partners in the East Coast fishing industry, and that they have an inherent right to participate in that industry. They were given that right by the Creator. In stating this, I also want to serve notice to the Government of Ontario that the people of the Walpole Island First Nation will begin to again exercise our inherent constitutional right to commercially fish in our surrounding waters and traditional waters. This economic activity will begin in the very near future and will create opportunities for our people. And now back to the business at hand. I want to conclude my remarks by stating the people of Walpole Island are very thankful for the tireless efforts from all the frontline essential healthcare workers in Chatham-Kent. And let us work together to eliminate racism wherever it continues and tries to persist. Shimi Butch, everyone, and thank you, and enjoy the ceremony. Thank you.
One, two, three.